Okay, so this is a quick video demonstrating the OneConsultation platform to introduce patient remote video consultations to MPFT. This is a example of what a portal would look like for one of our clinicians. When this is configured, we will ask clinicians to sign into the portal using their MPFT credentials, which are the same credentials that you would use when logging into one of your laptops or PCs. So here is the waiting room that's been established just as the purposes of this demonstration, and the plan is to have tailored waiting rooms for specific services within each of the care groups for the organisation. So that's where we need your help to think about which services would need specific waiting rooms. We can then have customized URLs at the top here. So for example, you could have tissue viability / consultations and have a waiting room for tissue viability. You could have a waiting room for East Mental Health, West Psychosis, East Psychosis, Shropshire Mental Health, and you can tailor those waiting rooms down to whatever level you require. You would have members of staff then have permissions to administer these waiting rooms and see available patients that need to be seen by yourself. So now in my waiting room, I've got a capable assistant helping me today to demonstrate this platform, and we have a patient ready to be seen, which is Sarah Smith. Now, at this point, you would check the clinical record, make sure that the appointment aligns with the person in the waiting room, and then only accept them into your consultation at the point that you've verified they're the right person to see. As per any GP waiting room or service waiting room, if there's someone in there that you don't recognise, you can remove them from the waiting room, and that's where you really have to have processes to work around the platform. So for this one, it's a patient we recognise, we see them, it's at the appointment time that we have seen, which is 8:15 at night, and we're going to enter them into the room. At this point, it opens a video consultation platform. We then click video call, start my video so you can see me. And then we can start the video consultation with that patient. So any second now, the video should link, and there's our patient, Sarah Smith. Hello, Sarah. So on this video consultation call, you can see that we've got really good quality. I can see Sarah, Sarah can see myself, and we can have our call really clearly, really quickly, and really easily. So at the point that we finish this consultation, so thank you very much, Sarah. How was your consultation today? Okay, thank you very much. Speak to you next time. Cheers, bye-bye. You can hang up at the bottom, and the waiting room shows that you can refresh the waiting room. You can see that Sarah's now amber, which means we've seen the call, we've had the call, and then you can then remove Sarah because we've done our positive consultation. What I will do is just show you a counterpart video which demonstrates what the patients need to do in order to access this same platform. So I'm going to do a quick demonstration now from the patient perspective. So I've got my personal iPhone here. I've been sent a secure link to a relevant waiting room for a virtual clinic through an MPFT service. The link provided I'll paste into my iPhone browser. So once the portal's loaded, the patient will scroll down. You've got the option to make a test call before you start the consultation to make sure that your device settings are set up appropriately. I'm going to put in my details and then click Begin Consultation. When it prompts the patient, they'll get prompts such as allow access to microphone and camera. Hopefully, if they're a smartphone user, they'll be used to such prompts. So when they're prompted, they need to click allow to enable voice and audio to be used in the consultation. At this point, the patient's waiting now, and they might be waiting for a clinician. When the clinician's ready in their own portal that you've already seen a demonstration of, they'll click enter room, at which point the patient is then admitted.